like with her baby and the traffic there. So it's good. You don't have to go far. I know exactly what you mean. And it goes, it's the Greenway, something Greenway, and it goes all the way through.
Yeah, and like there's traffic.
Okay. Yeah, I will do that when we're ready.
My daughter.
There, are you,
like,
you're good now?
From those battlefields. I just was walking there like 2 weeks ago.
So
It's huge. Stones River Battlefield. Yeah, well, it's a national battlefield, and for Christmas, they had all their little tombstones had little wreaths. I'm like, oh, this is a mini national cemetery. Like, it was just beautiful. I never knew how much Civil War history is in that whole area. Have you been to Franklin when you visit your sister? Let's talk about Civil War things everywhere. I just never knew. I mean, it's all Confederate, of course, but
yeah, we were there.
hang on.
You all set? Okay. Good afternoon, everybody. Welcome back to this new year full of Bridging the Gap. Brana, it's nice to see you. Welcome, everybody. I am on. I am on. Yep. Are you plugged in? Are you good now? Super. All right. Well, first, unlike our previous X number of months of meetings, this is going to be much more free form, and we're going to have a lot of discussion. And I've spent a lot of time with Francine trying to herd the cats with respect to all these categories and proposals, and nothing is as neat and as orderly as we would like it to be. But I think if we keep working on a process of elimination, we'll get to some places. So first order of business is entertain a motion to approve the minutes.
So moved.
Support. Moved and supported. Any corrections or questions? All in favor signify by saying yes. Yes.
Yes.
All opposed, say no. Good. All right. I don't believe we have any old business that I'm aware of, so we'll go into the new business. We have the so I have changed the agenda from what, I mean, we're still going to cover these things, but I talked to Francine and said there's some high level things that I think I'd like to talk about, particularly before we get down to saying yes or no to any particular proposal. I'd like to narrow down the categories and the nature of things that we want to fund or not fund. And so to that end, Francine, do you want to explain these handouts that you have there?
Absolutely. Thank you. So in front of you, there's a couple sheets that are printed out just for your purview while Commissioner Martis has a plan that an interactive discussion. So the first sheet that you have probably looks similar to what you have seen before, which is every program that's detailed. Now, if you go to Schedule B, all the way to the far right, you will see what category that falls into. That correlates with the book you were given of Exhibit E of the categories where they fall into. So that will come into play when we do this interactive discussion, just so you know. So if you want to go along in your book, it is under tab 4, page E4. That's Exhibit E, E4. And that could just be for discussion when you're going through the categories. The other handouts that you have are the ones that you've seen that were sent last week. Those are for the votes received of what programs would be a yes and what programs would be a no. And those are printed out in color, just so you have them in front of you in case you want to look for it for any discussion. If there's anything else that you would like printed out in the future for future meetings, please send me an email. That would be helpful for your discussions.
Okay, any questions on that before we move forward? It's very cumbersome because they've given us very precise categories, which turn out to be very imprecise and aren't really a good description of actually what's in each category, though they do fit their definition. So for instance, if you want to answer a basic question about, do we as a unit want to recommend funding transportation? That's a category that's natural in my mind, but doesn't appear as a particular section here. But I think that's the type of questions I'd like to talk about today. Likewise, a question about telehealth. Building structures, or, like her house proposal. Is that a category of things that we want to fund? And so I want us to help prioritize the various types. Of course, they fall into these various categories under this rubric that we've been given, but it doesn't always lend itself to the most clear and easily understandable language if you're not buried up to your neck in these data, which not all of us have had the time to memorize these cumbersome name tags, if you will. So kudos to Francine at the very last moment helping me put together this. Are we able to share this now? Okay, I have a screen here that the more I look at it, the more muddled it becomes in my own mind, even though I'm part of the reason it exists. So once Jen gets it up on the screen there, we can talk about it a little bit. But I guess the main thought for me today, and so long-term, my hope is today we can narrow down categories and hopefully rule out things that we don't think are a priority. And I want you guys all to tell us why. Next month, I hope we can narrow it down to which individual programs we definitely don't want to fund. And by month 3, March, I would hope we'd be ready to come to a consensus on what we want to recommend to the board. Okay, good. We got the screen up. There's so much data, it's hard to do this in a font size that's good for everybody. But as you can see at the top there, this number says that we have about $1.5 million to spend in this round. You can see that number up there. Now I'm dealing with a new mouse and other things. However, the total of requests is $8 million. So there's obviously a lot that's not going to make it in. Full disclosure, most of these are 2-year proposals. For instance, the sheriff's proposal, however, was for until 2040, I think. So that extrapolates out to several $1 million, but it's over a different date range. All that being said, we have $1.5 million that we're dealing with right now. We expect that to continue to go up. But it wasn't so neat as to say we're looking at spending $500,000 a year for 3 years, because the proposals aren't structured that way. They have different date ranges. So as long as we fill it up inside that $1.5 million bucket. So there's a lot that's got to be weeded out here just by the limited funds. Any questions on what I've said so far? And yes, of course, we appreciate all the survey work that we've done. We're going, of course, to take a look at that, but I really think before we get into the details of which proposals are best and worst, if you will, we really want to know which types of proposals you think are non-starters, which types of proposals are worth pursuing in greater detail. I think all of us would recognize there's a place probably for some bucket for medical assisted treatment. There's obviously going to be a place for counseling. The more debatable things are transportation, telehealth, et cetera, because we only have so much money. So we have time in the next month to, if we say MAT is a value, and it's hard to imagine that in some form it's not, then we talk about what's the format for that, which proposals make sense. Is that clear? I just, if we start with proposals and work in the wrong direction, I'm afraid of where we're going to end up. So if you look at the top of this chart, and I will zoom in, originally I was going to pull these sheets above the line for saying we're going to include this category and below the line. But when I think about this, my thought is, well, transportation is an obvious bucket. That doesn't show up in a neat category at the top. It fits as a subsection of several options. So it's harder for me to do that. So I'm not going to do that. But you look across the top, we had a proposal for every category except harm reduction. Is that right, Francine?
And prenatal, and there's other ones in here. And so when you read these, if you see A, you see where it's treatment for OUD, opioid use disorder, and A, it correlates exactly with A in your exhibit E.
Right.
So all of the letters will coordinate for that. And so we did not have a proposal for harm reduction nor strictly harm reduction, because there's some overlapping, because there's multiple categories in things, and for prenatal.
Right. And so to look at the category A, for instance, treatment for opioid use disorder, we scroll down and we realize in that bucket, it's cumbersome to zoom in to scroll at the same time, that we have is not Work at Health a telehealth proposal? But, and are all the telehealth proposals there? They are, right? Bicycle Health is the other substantial one that was a telehealth proposal, as I recall.
Yes, some of these are multi-uses if you see several numbers. However, it goes with their primary service. Even though they're telehealth, their primary service is to provide OUD treatment.
And so then when you look at her refuge, that shows up as treatment, yet I think of it as more as also shelter, which makes it, in my mind, in some ways similar to what Share the Warmth was proposing, even though they were adding staff to do some other things in their proposal. So it's a very muddy mess with respect to how these things fall into categories. I think to start the discussion today, and I will add this as well. If we run into some things that we'd like to bring in another expert to give us some more insight on one of these areas, Francine is going to talk to us about MAT next month. But if we have more questions about telehealth or something, and you guys would like to hear some further testimony from somebody, just let us know and we can accommodate that. So let's start with something that's pretty benign, I think, I guess I'll put it this way. There's no local people we're asking. No, I don't even want to say that. I can't say that. Let's start with the question of transportation. If we have $1.5 million and 8 point whatever million dollars worth of requests, how would you place transportation in your order, kind of this hierarchy of needs, as something we would fund? And I will start by saying, personally, I think we have more important things to fund that have a greater impact. But I'm one voice, and if I'm not hearing yours, then I won't feel like we've had a productive meeting. So let's go Sheriff and then Sarah.
So I agree with the concept of how we're working through this. In my mind, it's all part of a puzzle. In my mind, it's all kind of, these pieces kind of fit together. And transportation does fit, but transportation for what? And so when we look at this, we kind of have to look at, okay, what is it that, what are the, as we're putting the puzzle together, what are the bigger puzzle pieces that we want to get to? And does it have to be an all or nothing? In my mind, it can be some of this and some of that puts together and makes that bigger puzzle come together. And I think you're absolutely right. Transportation is one of them because we hear it over and over and over again. But what impact can we make in transportation? We're not going to buy a vehicle and hire a driver to do that. But could we have vouchers? Could we do a, some kind of ride share thing? How is it and to where? Is it going to be to treatment? Is it going to be to counseling? Is it going to be to medical appointments? And so I think that absolutely this fits into the puzzle somewhere, but probably not not the big pieces. It's kind of the smaller pieces that we're looking at when it comes to transportation. Does that make sense, or did I just ramble on and people out there in the internet world heard me ramble?
No, other thoughts along that line? This is our time. We've all been listening to all these presentations, desperate to have a time to have a deliberation. So Sarah,
I agree with that as well. But we all know transportation is it's a necessary evil that people need. But I agree with that line of thought as well. Not that, I started doing my yes and no stuff, and of course I ended up with way more yeses than no's, and I bet you all of us were that way. The way I guess I approached it is considering transportation and telehealth and all of the other presentations is who's local, not that I didn't consider other, and who's already doing a good job. who's somebody that we can trust with this money because they're already doing a good job. And I think one of my focuses is because I know there's a lack of opportunities for our youth out there. So being part of overdose fatality review, we have seen in multiple cases that we have reviewed that a lot of the problems start when they are young. And middle school or wherever it started. And if we can maybe fund some programming to, and I'm not saying all of it, but to help with the youth, if we can start early, I think that would be a good consideration.
Okay. Terry?
I agree very much with what Sarah has just said. However, I think what you're looking at is we want to focus on a particular area and somewhat yay nay it.
Yeah, let's sort out
The
transportation.
area of transportation, I think, as both have said, it's vital, it's a necessary program. However, I think there are multiple other programs that are greater in need than transportation. One of the issues I had with the transportation presentation and things I heard subsequent to that is there needs to be some collaborative effort with those people who currently offer transportation. We have Runaway Transportation, Department on Aging. We heard that the Alcoholics Anonymous provide transportation to their people for medical purposes and so forth. So I have multiple groups providing transportation, but none working together. And I think maybe in the future, if there be a presentation from transportation, excuse me, that it need be a collaborative effort with those groups and saying, we have gotten together and we have worked out a solution. Think about it. There was some discussion. If the AA people, that's all members themselves providing this transportation. Well, if we provide fuel to those people, look how many people we can activate for transportation purposes. It doesn't have to be somebody that's an AA member. It could be somebody that has another substance abuse disorder or some other problem, and they still provide the transportation. So there needs to be collaborative effort in transportation before I would rise it to the top of the water.
And we will look at a new round of proposals in 2 years. And if that's an area we don't want to do right now, if those groups here are concerns, they want to bring a collaborative proposal to us, then it certainly can be revisited. Tim?
I was just going to agree
Mhm.
that transportation is really not the forefront of all the problems. A lot of these providers, Parkside, those Share the Warmth, they do try to provide transportation as well. So when we're looking at putting this puzzles together, and that's exactly what this is getting the most use out of our funds. Transportation is covered in a lot of times through those other entities. And all we have to do is get them to collaborate together. And the other piece to that, which is a more complicated discussion for all of us, is the impact of telehealth. Can it be part of this solution? Because people don't travel well from Morenci to Adrian to get their services. So we may have to sometime consider something we're really not comfortable with, and leave those things like transportation to the side.
Well, and I will say too, that Terry and I will always be free to bring the perspective of the commission as well, which in the end will have the final say on this. And talking to Terry and others, I don't think they're supported the commission to fund a lot of public transportation through this money. That's a separate discussion that needs to take place. I think we all understand that there will never be enough money to satisfy all the demand for very cheap transportation. And it starts us down a road that, I mean, I study, I think I said it when they spoke from Runaway Transportation. Public transit is always a deficit operation everywhere it's done. And I can't change that, but neither can we sink this really pretty precious and rare money into a much bigger systemic issue. So Unless there's another strong Sarah?
Also, considering transportation, and perhaps you can help me recall exactly what was said, but was there not an issue with how are they going to police? They can't police where these people are going. They can't give them a voucher that looks different from the rest because then it takes away from their privacy and why they're seeking transportation. So that just brings in a whole other issue of that
That's
would
fair.
have to be dealt with.
Yeah.
Mhm.
And look, I know we are conscious of the fact that all these presenters can watch these videos and hear what we have to say. I know that none of us hold any of them in low regard. We all respect everything they're trying to do. We're not casting aspersions, but we're now at a different level where we're making determinations about public resources. And we will very well have to subject some of these proposals to criticism. And they will have to understand in general terms, it's not about anything they're trying to do individually, but we have a metric that we need to try and comply with. So, anybody watching this from home, understand that's not our deal to take shots. But when I heard that one of the presenters was suggesting that for $5, they go all the way to Cement City to transport somebody, that's not sustainable. And that's not a problem we can solve here. But it is a fair question for us to ask about that. So if I were to sum this up and ask Carissa or whoever's taking notes to maybe to keep track of this summation, we feel transportation is of course a value, but we wouldn't place it in the top tier of the highest priorities at this point in time. Is that a fair, in general, do people agree with that? Or do we need a show of hands, or it doesn't look like anybody's dissenting? And feel free to dissent. Gary?
No, I have a friend who does not have an opioid problem, but his car broke down. He has no job, can't get to a job without any transportation. And so it's definitely, something that should be on somebody's table. How do you reverse, how do you get this person back to where they can be self-sustaining and make it go? But I think you're right. It isn't necessarily an opioid issue, but it's an issue that should be given a priority within the county.
Yeah, within the, community of
Community, yes,
municipalities,
yes.
we need to
It's very
work on that
valid
thing
and,
going
yeah,
forward.
and I think that's a good point.
Let me strengthen this. Is it safe to say that out of these proposals, we probably would not recommend any of the more pure transportation proposals? Do you guys agree with that? That's not one we would advance, understanding that there's $8 million of request and $1.5 million to spend. Is that too strong of a statement? Okay, that allows us to really kind of eliminate a number of categories just on a categorical basis and not having to spend the time to look at the details of each proposal. The next area that I want to talk about is telehealth. And I didn't put these in any particular order. I'm just trying to think of the areas that I had questions about. It's clear the telehealth providers feel that it solves many problems. The people offering much more conventional services, in-person services, said telehealth can play some role, but we're not sure that it solves as many things as we would hope. So understanding that we have, what do we have? Work at Health and Bicycle Health, are those pretty much our two?
U-turn health,
And U-turn Health. And is that not in the yellow category?
that's in the blue. That would be in D.
See, that's the hard part of these categories, is I see those as related, and I understand why they are where they are.
Because where they fit,
Right,
provide the service.
into the
In
category.
Exhibit E. Mhm.
Exactly. So do we have strong enough feelings on the concept of telehealth inside the broad spectrum of all the other proposals we're seeing? Would you categorically rule it in or out? I don't, as a category. I don't have a strong answer on this, but I would like to hear your thoughts. Brana?
I'm a proponent of telehealth, particularly in rural communities and in northern climates, because consistency in counseling or peer support is critical. And if someone is isolated and unable to get to their appointment, or let's just say the roads were bad and they live down a big dirt road, I don't know. It's an option for them to continue treatment. I also know of a situation, just as an example, that of a few years ago where it was a younger person in treatment, a counseling treatment, and substance abuse was a factor. And due to no fault of their own, they had to move. And I know this is Lenawee money, but this was a Lenawee child that had to go due to family situations. And they didn't, because of telehealth, they did not have to be uprooted from the person that they had been comfortable with, that knew them and that had been able to be successfully working with them. And if telehealth did not exist, that would not have been an option. You know, it was around pre-2020 that telehealth across all medical areas, not just substance abuse treatment, was very much in the forefront of discussion in the state. Because it has to do with insurance, paying for a telehealth visit versus a in-person visit and on and on. And so it becomes a state issue for Medicaid and everything else. And during that time, there was research being put forth. Sorry, I don't have anything at my fingertips. And if there's questions about it, looking at research would be the way to go. So you can make a data-driven decision that has some basis in fact and not feeling or anecdotes. But the outcome then was that it is effective, even in the physical realm, not just mental health, but particularly with mental health, behavioral health, substance abuse areas. So I personally am a very strong supporter of a telehealth option.
The presentations, by the way, I think a number of them did have supporting document links at the end of them for further study. Other thoughts, I'll give you a frame of reference. We have $1.5 million to spend. Bicycle health was 810,000. Work at health was $500,000, and U-turn health was 300,000. So those are big chunks of our money, depending on how that slices. I'm not trying to tilt the scales against it. I'm just giving a bigger context to that. Other thoughts on Troy?
So I'm not against telehealth, but I think that it has a role along with other conventional treatment. And because there are going to be places where, obviously I have a place where telehealth would be more difficult because there's not a lot of privacy. So in other areas there, I can see where it could be a good supplement, may not be the main way, because there are other advantages to in person, as we all know. Some people do better. You know, some people are better learners when they're actually physically at a location. Some are better when they're not. So I think it's not a bad solution to have that as an option, but I'm not 100% on board with it being the only method.
Sure. Just you in particular, was there what, 1 or 2 proposals that would involve app-based interaction in the jail?
Correct.
Would you rule that out categorically, or
Well,
it could be valuable depending on?
There were some gaps in the information that was being brought forward, and because I went to my captain afterwards that runs the jail, and he brought up several valid points that of the struggles that we would have in the jail doing that. So, and part of it had to do with who's providing that service, and so yeah, so there was going to be some issues
Sure.
when it came to telehealth in the jail.
Okay. Tim?
Just to add, Ronna, I'm on board with you. This is a great opportunity to do something different that serves people in rural communities in particular, using a method that hasn't been tried in this realm. It does show promise in the health field. So the one thing or 2 things I latch onto with it is this generation is comfortable with using this technology. They're okay with having a conversation or even a text or whatever. The other thing is when you use telehealth, it's less stigmatizing to the person that's in recovery. So it does allow for a lot of people to get the services they need without having to be stigmatized by going somewhere.
Terry?
I agree that there's a value to it in that it does not stigmatize the individual because it's not broadcast other than to the user and the provider. And I think there is definite place for telehealth. It has, we all use it probably during COVID, many people. However, and I don't want to eliminate it as a possibility. I lived with somebody who had a substance abuse disorder. And believe me, those people are hustlers. They know how to hustle the system. They're masters at hustling the system. I can tell you of a situation I saw on a telehealth thing. It was just a video presentation where the individual was telling this counselor that, I have been sober now for about 2 weeks and his works are laid on the table right in front of him.
Mhm.
So as soon as the telehealth program's over, he's going to shoot it up. It provides the end user with the opportunity to hustle the system. Saying that, I like the concept, like the idea that we can reach people who heretofore we couldn't. The stigma is gone, and it also addresses some of the issues of transportation. We can't get to and from the venue, then telehealth will solve that problem. But believe me, they will hustle the system.
And I think hearing, and of course, again, not casting aspersions at the in-person counseling providers. I think what I thought I heard them say was by being there in person, there's more accountability and probably easier for them one-on-one to detect some of the fraudulent things. But it doesn't rule them out in that setting either. And I think there's a larger overarching principle here that none of these things will help anybody that's not determined to make a change. That part, it doesn't matter how good the system is, how clever the interface. And, like I said, are we dealing with a population of 500, 3,000, 10,000 in the county? I don't know. And of that percentage, what percentage is actually reachable? And those are things that you can't put a number on, but it's part of the vexing part of this question. So on this particular topic, and I'm not trying to cut anybody off, but would it be fair for me to describe our discussion in this way, that we think telehealth can be a very important part of what we might recommend, but we probably want to take a deeper dive on the 3 proposals, and certainly we're not putting it in the ruling it out bucket right now. Well, this is something that we want to explore further. Is that a fair assessment? Okay, we can make notes to that effect. Okay, is this process working for you guys all right? I thought of 100 different ways to do this, and honestly, I didn't like any of them. So, oh yeah, I will hide that, yeah.
So Kevin, is it fair to say we are really kind of thinking of 3 buckets here? It's like the absolute yes, the ones that like, they're okay, and let's just do a little bit deeper dive.
Right.
In the absolute no's.
I think so, and that's how I saw it too, and that's what I said to Francine about the either or survey, that I only put 1 yes on mine because most of the ones that I hadn't excluded, I felt we needed to discuss as a group. I had my personal leanings, but I thought really until I take your input, I don't want to stick my neck out on them. I mean, I can tell you 4 or 5 of them that I think we ought to be doing right now, but I'm not going to lead the discussion in that way, right? And I think there's a number of them that if we did sort of electronically raise our hands, rule out. But again, today I wanted to focus on categories and not providers. I hope that is self-evidently a good approach. I'm going to zoom in on this one, and it just turns out there's only 1 provider, but it's this bucket here of training. And tell me, Francine, if you would, what was the nature of the proposal that put it in the transportation bucket, or the training bucket?
That was McCullough Vargas and Associates. That was the infrastructure, the infrastructure is under the training category.
And what was the nature of the infrastructure? That they were looking for?
They're building their software and computer systems.
That's right. So understanding that the only proposal we have in that category falls under training. My thought is that I would not support training being, that would go into my absolute no bucket. But I would like to hear your thoughts on that. I mean, if training had 10 different other proposals of another nature, it would be able to expand a little more on it, but this particular one, it's not a great fit for that particular bucket, but it's, you know, it is what it is. So thoughts?
Um, I think there were parts of other proposals that did talk about training, but not in the sense of being part of the proposal. It was they're going to offer a service and they had to get training to provide that service. So I think we can look at training as a part of how they're developing their program, not as something they were offering us. And yeah, that one of itself doesn't warrant consideration.
Okay. So since that fits into the training category, would you say in this example, would you all agree that we can put that in the no box? Okay, looks like there's consensus on that. Oh, I'm gonna put my pen. Okay, here's one that I know is near and dear to Gary's heart, but we still have to talk about it. And that's the idea of constructing shelter or adding access to shelter in this case. What are your thoughts on taking this money to try and, you know, I know that the commission had, in the previous iteration of this committee, the commission made it pretty clear we were not going to fund structures. We did have only one peer request to help fund a structure. I think in general, the consensus was, and stop me if I'm mischaracterizing this, our contribution would not have made enough difference to make that project viable. And that they had much higher hurdles to cross in order to make that go forward. Though I think we all respect the concept and certainly want something like that to succeed. So if we're going to look at that, furnishing a facility type, and there was another request for a facility as well, as I recall, either to acquire or to build one, I think from McCullough Vargas. Would you guys be content saying those types of proposals are not in our yes list, but probably in our no list? Do you feel free to add any?
I just want, the McCullough Vargas was the Recovery Community Center.
Okay.
So it was different than a treatment center, just for clarification.
Right. But in my mind, I think we're furnishing facilities for various types of care. And is that is infrastructure rather than one-on-one treatment really where we want to direct these limited resources? So my hunch is no, but I'd like to hear your guys' comments on that.
Well, I guess, you know, I think that we spent 9 months studying that topic and we were thinking that it would be nice to have some kind of recovery facility within our county. I guess it would be nice if I don't think we can do anything this round for sure, but it would be nice to have our vision of greatness, you know, what are some of the items that we'd like to accomplish someday, you know, and so we can continue to work on it. You know, I'm representing Kiwanis, and we happen to have our Community Impact Committee meeting this past week. And also I'm on the foundation board for Kiwanis, and we talked about it, and we have a limited spend this year, a budget of $124,000. But, you know, we have 5 million in our foundation. And we talked about, you know, if the right something came along, maybe we could get behind it and spend a lot more money or whatever. And I just like to, I don't want to just bury it and not be able to talk about it anymore. Can we have some kind of a wish list or something that we'd like to accomplish someday, and maybe it won't apply till the next round, or, you know, what can we do to continue to keep it out there?
My thoughts as commissioner and chair of this committee is just like the Her House proposal. If we saw that 70 or 80% of the pieces were in place to get this thing going forward, and the county could play a role either through this money or other money in helping fill the gap of what was left there with other partners. And if we can seek support with Lenawee Now, we need a much more concrete proposal, I think, with an idea where the bulk of the money, not just to build it, because we see examples all the time, It's easy to attract donations to build the shiny bauble and to get there at the ribbon cutting ceremony. Then when stuff starts to wear out 5 to 10 years from now, nobody says, oh, you mean I can write you a check for $50,000 and I'll pay for 10% of a new rubber roof? Gee, can I get my picture next to the roof? You see what I'm saying? It gets much harder then. And that's where the long-term problem always comes. It's easy to build, hard to sustain. So am I saying too much with respect to this topic? I would put it in the no category. We're not going to fund things to create more facilities, either new or rent or lease or whatever. But I certainly agree with Gary that if a proposal comes forward collaborative with Kiwanis and other entities, and we see where we can play a meaningful role in that without trying to fund the overwhelming proportion of it. I know there's not commissioner support for the county to create such a facility and to be the long-term support of funding for that. We're still looking at multi-tens of millions of dollars with the courthouse and things that we absolutely have to have. And so is it fair to say that we're going to put these types of requests in this round of proposals in the no bucket? And if somebody disagrees, please say so.
Well, I think it would be nice to have it some kind of a, a wish list or something like that.
Understood.
To continue to, at least keep it out there that these are some of the items we would like to try and help build.
Okay, Sarah, then Terry.
I did love the Her Refuge presentation. I thought that was such a cool idea, but I do think you are correct in saying that they're still at the very beginning, and that could be fraught with many problems. But there's nothing to prevent them from coming back in the future and requesting funds, especially if they have some more people with them on board, correct?
Absolutely. And we said that then. And I think many of us, we didn't say it out loud, but the harder question for that is building the structure, okay, but with a facility like that, that's supposed to be at no cost to the people who are coming there, now you have a very expensive sustainability problem. And as I've said to some folks, facilities like this in Grand Rapids, they have their benefactor class. We have our benefactor class here in the county. The difference is their benefactors start with a B billionaire, ours start with an M millionaire. I love the hearts of all the people that continue to give, but you need billionaire kind of funding to support. Somebody's got to be able to miss $2 or $3 million a year for many, many years and not have it a significant impact on their financial. And, I'm at least 2 or 3 years away from being in that position, so I can't help you. Anybody else? Terry, you want to offer a comment?
I'm a couple of lifetimes away from being in that position.
Me too.
I agree with what Sarah said. I was quite moved by that presentation. And I think it has a definite need. Females, I think, have a bigger stigma if they have a substance abuse problem. It's more unacceptable, if you would, for a young lady to do it than a young gentleman to do it. And it would be a great program. But I jotted down over a period of time here, in fact, since we've been starting this, notes here and there as to what would impact my decision. And we have all alluded to it here in this situation, and that's sustainability. I don't see any guarantee, even the slightest guarantee. As much as I love the program, I don't see any indications of sustainability. In the same vein about future, and as would have to do with what Gary asked also, I think the chair has made it very, very clear to the presenters. Don't give up hope if you don't get funded this round. There are more rounds to come, and you can apply again, or you can alter your program. You can collaborate with your program. But everybody knows if they are not selected in this round, they can still come up to the plate again. That's been made clear to all of them.
Yeah, I agree. I absolutely agree. Any other, Troy?
Just one comment, representing law enforcement, we're always looking for alternatives to take people to or suggest. We're always looking at giving information to family members that hope, et cetera. So I think we definitely, we're bridging the gap committee, and we definitely are identifying some of those gaps. But I agree that I don't think the county should be in the business of running those and constructing them. But there is the need, and I hope that those who have that in their, in their wish list continue to come back, because we definitely have that need.
Agreed. Anything else? Okay, I think we resolved that one. We're expecting to be done here at 4. Is that correct? Is that everybody's expectation or? Okay, is there something else coming in after this? That's what I thought. We had a hard stop today. Very good. We're kind of picking off the easy ones. They get muddier the closer we dive down into this, because not only do we have offers of doing, like counseling, but we have peer counseling, we have professional counseling, we have some focused on young people, some coming out of the courts, some as a result of legal. I mean, it's a very messy thing to try and categorize, so we can start to, do some deduction here and narrow this down to a list. Tell me a little more about the Parkside proposal, Francine, the reset proposal under connections to care. Can you remember what that was, or do we need to dig into the notes for that? Connection, Parkside reset, 144,000. Going into
Stanford program that they were going
In the
to deliver to
schools.
schools.
Yeah, Reset for Success was the one in the
That's right.
schools. Then they had youth prevention and intervention programs was directly involved with all the youth.
Okay,
And the other one was peer and case management.
so 2 of those are directed at young people,
Yes,
and 1 is for adults.
correct.
Let's,
Which includes juveniles, but the focus was adults.
but none of these are in the court system, right? The juveniles, it was, I thought, mainly in the role of prevention, right?
Correct.
Right. So, and what's the total? So one was $144,000 and $251,000 for the 2 Parkside proposals that affected young people, right?
Sorry, peer and case management was 36,600.
Remind me what that was. I remember that was pretty affordable. What was the nature of that
It's
proposal?
helping people who are not currently on Medicaid to be able to get access to
Oh.
services that were funded.
Okay, got it. Okay,
It's similar, share the warrant and the same type of services available too.
okay. So we have several buckets left now of, I think about these, each is human to human contact, whether you're calling it peer counseling or formal counseling or substance abuse, addiction, however you term that, as opposed to telehealth, as opposed to transportation. This is now various mechanisms where we're putting professionals or peers together depending on their place in life, coming out of court, in school before they get in trouble, trying to keep them out of trouble, or in some cases, money to people who otherwise can't get access to care. I don't know how to begin to prioritize between those options because they're all really important areas. But it appears to me when you add up the cost, we won't be able to fund all of them. So as you think about those categories, and maybe Tim and others who might be more on the front line or have seen the front line of this, if we all want to prevent kids to the degree we can, right? We get that. Then we got people who are in the throes of substance use disorder trying to get out, and the ones that are making serious attempts deserve the most support, right? The ones who have really decided to make a change. We have some who are there as a result of court order. We have some who have decided on their own to try and make a change in their life. We applaud all of them. If we have to make a choice between those categories, and we may very well have to because of the dollar amounts involved, what does our community experience tell us about where to direct that? Understanding we're certainly gonna have to leave money available for medical assisted treatment in some form at some venue. You know, there's certain things that I think we agree we're gonna have, and we gotta fit these in. What are your thoughts on that? Because in my mind, that's one of the thorniest questions we have to work through. Sheriff?
So yeah, there's a lot. I think Terry's hit on it. I think everybody has. There's a lot going on in Lenawee County when it comes to the person to person, you know, and if I can look at just the peer coaching and the peer support, and there's a whole lot of different organizations or people trying to help that have peer support, but they're all one-off. And I can give you the example of Hope Not Handcuffs, when we needed a peer support person because we had somebody in our lobby saying, I need help. And we couldn't find anyone, but everybody talks about having them out there. I think that you're absolutely right. The one thing that we do have is we do have some in Lenawee County that are, that's kind of what they do. And some of them have asked for money. I know Parkside's one of them. I can name some. That CMH is another one. McCullough Vargas is another one. So there are ones out there, but they're all doing their own individual different thing. And I get it, because some of them are businesses. Some of them are for-profit businesses. Some of them are, have other funding sources, because they have to look at that. If we had a magic wand and we could just say, let's all play together and let's all, you know, have a pool of peer support people that are well-trained, that we can draw upon for all of our different needs, that would be fantastic, but that's not how it normally works. So you're absolutely right. There's those services out there. Unfortunately, sometimes when you need them, they're not there. So.
I guess, and that's a fair dividing line. Everybody's presenting new programs to us, but we haven't, some of you will know because of what you do, what percentage of those services are already available without adding another program or funding another mechanism for that. We would maybe want to prioritize the ones that we think are most useful where there's needs not being met currently, unless we think the better solution is to add more firepower to the areas where they're weak. But then I hear the constant caveat from many of you that I've talked to is it's hard to hire and retain very competent help, particularly in Lenawee County, because we don't have the same resources of a Washtenaw or a Kent with deeper pockets. So to attract and retain the high quality, no offense to anybody that's currently doing, God bless you. But that's just a practical reality and so it's a question I can't answer, but given how much money we have, if we give somebody $150,000, how easy will it be for them to actually find and retain the staff to add the service?
And on top of that, Lenawee County does not want to be the employer of those. In other words, you know, we do have needs for peer coaches in the jail, but we don't want to be hiring peer coaches because other places do better jobs at doing that. So we want to make sure that we're reaching out to those other places, because again, you're right. We don't want to be the employer of most of these.
There's a number of things that government is really bad at. And that's probably one of those things that we're not great at, though community mental health does fantastic things. But neither do they come in and talk to us commissioners every month to ask us what they should do next. And that's probably good for them. Tim.
I guess if I was gonna have to say where I feel strongest, this money could be spent is with you. It's really, you have to stop the problem before it becomes a problem. It's, what is it? Easier to build strong men than to fix them.
Yes.
That's really where it has to start at. And by doing that, you oftentimes touch on the home. If you're doing good work, you're working in the homes with the families who have those problems as well, talking about the parents. So you can probably get more bang for your buck by focusing on the youth.
And it's an area that's currently being underserved, right? I thought I heard the lady say she's really mainly working in, what, 1 or 2 schools right now?
Yeah, there's a little bit of a political issue around that. School districts don't like, sorry for everybody to hear that. School districts don't like to say we have a drug problem in our school. They don't like to say that kids are vaping in fifth grade. Those are real issues. And the way you deal with that is you got to get in there and have in every district, because frankly, from my past world, I know that a lot of our families that are struggling tend to move a lot. And they're going from district to district to district, and they need that support wherever they go. If it drops off as soon as they go from, one side of the county to the other, then they're really in trouble.
Understood. Terry?
I think I've made it clear a couple of times that getting to the youth, much as Tim said, is where my passion lies with this program. There is no better way to attack the problem than to eradicate it young. If they get to the youth young enough and they don't become involved in substance abuse, if they don't become abusers, then they don't have to fight this battle every day for the rest of their life. If they become an abuser, and if they are an addict, then they fight this battle every single day for the rest of their life. If we're able to eradicate that at the seed level, that problem is gone. I don't personally see no better way to attack this problem than to deal with youth.
Is it fair to sum that up by saying that youth programs would make it into our highest priority list? Understanding we may still have to make compromises, that's okay, good. And I like it because it's not well served now and it has great potential. And, yeah, and having personal experience with my family of people with various mental health disorders and children and all the things that brings, it's hard if you're in a dysfunctional family and you're a child, and no matter what your own innate abilities may be, the environment around you can just suck your potential away. And we always tread into that area of how much should a government interfere with a family. On the other hand, there are young people whose potential is being squashed by their home environment. I grew up in a difficult home environment with a single mother who was a wonderful mother, but it's a different environment than growing up in a stable nuclear family. And I didn't have that experience and was blessed to give that to my kids. They still get mad at me, so I didn't fix all the problems, but, so I appreciate that. We're down to about the last 3-4 minutes. We will stick with this same date next month. So, at 3 p.m. again on 2/18. I'm not trying to cut anything off. We do have 3 minutes. Was this format useful? And secondly, what other thoughts do you guys have or things we want to think about for our next meeting? Because we're probably going to start weeding out specific programs next month because I think we're kind of run out of categorical rejections. Brana?
I don't know if it could fit in any way, shape, or form in the next meeting, but going all the way back to how the sheriff started this conversation, which was fitting things together so that, yes, youth are very important. And then how do we do that from many different angles, not just all in one bucket? So is it telehealth and in person and in the schools and the juvenile, is there a way that we can see how it's fitting together and not just look at each isolated service because it's part of the solution together?
Sure.
Just add something. So what I heard when you were talking about youth, that's a proactive approach instead of reactive programs. So if you want to fit the puzzles together, what are all the proactive approaches to look at it? I think is an important part of the puzzle.
We can kill one more in the last 2 minutes because I don't think there'd be much disagreement on this category. Marketing, public relations. It fits into one of these baskets, but we saw 2 presentations, both good, one extremely good, who did come back with us and show measurable results from what they were doing in another state on this issue. I would argue that understanding we still may have to make compromises once we assemble the top 5 to 10 programs. Would you guys agree that a commitment to this topic, specific marketing, if it's affordable, would make it in your to-do list? Because it sounds like we had a number of presenters that had more capacity and didn't have enough people aware of their services. In the minute and a half we have left, thoughts on that?
I agree. I think that we all thought of different programs that could be better better put out there, better communicated if we had that ability, you know, the Red Barrel program that we offer and others do too. Just getting that information out there is a good thing.
Sarah?
And just to remind you, I did speak to a peer coach in another county, not here, unrelated to our programs that we're looking at, that I asked him, I gave him several categories and what he thought would be something that would be helpful to the community as a whole. And I gave him the marketing as an idea, and he thought that would be really good because people don't know where to get help. They might reach a low point and not know where to go.
Good. We are now at 4:00. Any public comment? Seeing no public comment, I would entertain a motion to adjourn.
So moved.
All in favor, say aye.
Aye.
Support, I'm
Opposed?
sorry,
I'm sorry.
Hi.
Yeah.
supported.
No support, got it. And thank you folks
Aye.
for being patient with us. All right.